Friends, today I'm going to answer a very common question that people ask me about hypothyroidism. And that question is, Doctor, I have hypothyroidism, which means that my thyroid gland isn't working well and isn't producing enough hormone. But why is my TSH high? Now, it's important to know that the TSH is the most commonly ordered test in thyroid diseases. And before we come to the TSH, let's understand what is hypothyroidism. The thyroid gland is a little butterfly shaped gland in the neck, and hypothyroidism is a condition where the thyroid hormones like T4 and T3 are low in the blood, usually because the thyroid gland isn't producing enough of these hormones. So T4 and T3 are the most commonly ordered thyroid hormone tests, while the TSH is a different test and it's called the thyroid stimulating hormone test. But that TSH isn't produced from the thyroid gland, as we'll see. Therefore, hypothyroidism is a condition where thyroid hormones are low in the blood, and if untreated, hypothyroidism may affect different parts of the body, causing problems like constipation, weight gain, abnormal mentation, and also reproductive abnormalities. Now, the TSH, which is the most commonly ordered test in thyroid dysfunction, is thyroid stimulating hormone. TSH is not produced by the thyroid gland. TSH is produced by a gland called the pituitary in the brain. The job of TSH is exactly what it says it does. TSH is thyroid stimulating hormone, and the job of TSH is to stimulate the thyroid gland into making T3 and T4, which are the thyroid hormones. And TSH, T4, and T3 are the most commonly ordered thyroid function tests. Now, it's important to remember that when the thyroid gland does not work, the pituitary in the brain produces lots and lots of TSH to try and stimulate or push the thyroid gland into working better. In other words, when there is thyroid gland failure or hypothyroidism, the brain produces lots of TSH and the TSH levels go up. Therefore, in hypothyroidism, the thyroid gland produces less of thyroid hormones like T3 and T4. And in order to make the thyroid gland work better, the brain produces, or the pituitary gland in the brain produces lots and lots of TSH. So in hypothyroidism, the TSH is high and the T3, T4 is low. Now, this is not true in all cases of hypothyroidism. As you can see, there is a mild form of hypothyroidism or thyroid gland failure called subclinical hypothyroidism. In subclinical hypothyroidism, though the thyroid gland cannot make enough T3 and T4, the pituitary gland produces lots and lots of TSH, and that TSH is able to stimulate and push the gland into making just enough T3 and T4. So in subclinical hypothyroidism, also called mild hypothyroidism or mild thyroid gland failure, the T3 and T4 are just normal because the pituitary is producing a little more TSH to make the gland work normally. Nowadays, many endocrinologists believe that most cases of subclinical hypothyroidism do not need therapy, but we do treat subclinical hypothyroidism in certain situations like pregnancy. So friends, when the thyroid hormone level in your blood is low, the TSH is high, and your doctor, if you're on thyroid hormone pills, your doctor may increase the dose of thyroid hormone medications. On the other hand, when the thyroid hormone level in the blood is high, the TSH is low, and if you are on thyroid hormone pills, your doctor may reduce the dose of these thyroid hormone pills. And when the thyroid hormone production is normal, the TSH is normal, and that's the situation that we all want, a normal TSH. So what is a normal TSH? A normal TSH is said to be between 0.4 to 4.2 micro international units per ml. but this needs to be individualized. For special groups, TSH goals may need to be different. For example, in pregnancy, we might like to bring the TSH not just below 4.2, but below even 3 or 2.5. In the other hand, in elderly people with cardiovascular disease, we may accept even a higher TSH, even a TSH value of more than 4.2, which could be 5 or 6, may be accepted in elderly people with cardiovascular risk and other conditions. So it's important to consult your doctor to choose your TSH goal and also choose the appropriate therapy. So consult your doctor, and let me summarize by saying that thyroid gland failure is common. This is called hypothyroidism. High TSH is a sign of thyroid gland failure because the pituitary gland in the brain produces TSH to make your thyroid work better. So whenever there is thyroid gland failure, the thyroid hormone levels are low and the TSH is high. Increasing the thyroid hormone levels in the blood can improve the high TSH and reduce it and bring it to normal. It's important to consult your doctor because not all people with high TSH need therapy. If your TSH is high, that means you do have hypothyroidism. You do have hypothyroidism, but that does not mean that you will always need therapy. So consult your doctor. Friends, it has been a pleasure discussing this common question about TSH in hypothyroidism with all of you. Thank you so much for listening to me.